strict academic definitions, but they're my own definitions of what is a good definition of health. So in my view, there isn't like a destination that you're trying to get to in terms of being a healthy person, but I really think it has more to do with the ability to move in and out of obstacles, or when you do get sick, being able to move through that with greater ease. Because inevitably we all will get sick at some point. It just happens. And that's not a bad thing. It doesn't mean we're unhealthy. It's really just means more that it's really how we move through it that's important. So that's one thing I wanted to mention. A definition of a good doctor. I think there is, of course, I think people oftentimes think of a good doctor needs to have a lot of knowledge, and that's really true, and skill in using that. But I think it's also really important to be compassionate and caring, and so giving people time. I think more and more these days people really need to be heard, they really need to be acknowledged, and so I feel like that's something that I can offer someone that's really, really valuable. And then the third thing, and this is, I think it's true probably for any doctor, but I think especially as a Chinese medical practitioner, is sensitivity. And this I really mean like in terms of the energy body, so which we'll talk more about in the next class, but being sensitive to your own energy is what really enables you to be sensitive to someone else's energy. And that just takes time to learn how to, you develop that. And I think some people just like any field, like you have some natural things that you like are inclined towards. And so I think that's an important one that is for a doctor to have. And then also, I think it's just equally as important to know what makes a good patient. I think mainly two things. One is the willingness to change. Of course, that's really difficult. Like if someone, they might want to change, but they're not really willing to do what's necessary to do that. And so it's my job to help them do that, according to their capability. It's not like, I never like bombard people with tons of things they have to do, but try to really like kind of take the whole picture, which we'll talk about in a little bit, but just look at the whole picture of someone's health and their lifestyle and everything, and really try to just highlight maybe one really major way, actually, just one major way, because that can be the most impactful thing. There's one thing you can change, and you really do that. So willingness to change, and the second is to be able to relax into a course of treatment, because Chinese medicine, like I said, is a complete medical system, and the way it shines is that it really does enable people to you're working with patterns, and I'll explain that a little bit more later, but in order to have long-term change that's beneficial, positive change, you really have to give yourself some time, because I like to use an analogy, and I'll probably say this again next time, because for me it's really useful metaphor, is like a large system of waterways. So in our bodies, we have all these channels of energy that are moving, and that's what you use with acupuncture. But when we have imbalances, somehow those pathways are not moving properly. They're either, and it can be in a lot of different ways. They can be going in the wrong direction, they can be stuck, there can be like boulders in the way, they can just be really low, the water can be really low, it can be really high. So in any case, we're trying to bring balance, and so I'll talk about that momentarily, but you just want a healthy flow. You want anything that's standing in the way, but that can take time. So particularly, it can be a lot easier to divert excess rather than to build up. So most everyone has a combination to some degree of what we call excess or deficiency in their system. So if it's a deficiency that we're trying to target, like for instance fatigue or low immune system, it can really be anything that can have a deficiency component. Even pain can be more of a deficient cause rather than an excess cause like an injury. But if it's a deficiency, it's going to take some time to build the energy back up. We can definitely do it, but it's really important that the patient be willing to work with that and acknowledge, or just see that I think it makes sense. I think it's common sense. People understand it, but sometimes you just have to explain it to them that it's not the same as, we don't look for overnight results, because usually those don't last. And even if we get some kind of overnight result, more than likely it's going to have some unwanted side effect. So that's a major difference that I see in between Eastern-Western approach is we can have a lot of beneficial long-term change with Chinese medicine without the harmful side effects. Almost no. I mean, it's very rare that you have any negative side effects. With herbal medicine, I mean, if anything, you might have if you take too much of something, you might have like a loose stool, But then you realize that's what it is, and you just change the dosage, and it goes away, So I think that's a really good thing. And then another definition of a treatment in Chinese medicine is really we're trying to address what we call the root and the branch. So the root is like the deepest cause of where we're imbalanced. And sometimes that's not, actually usually that's not very apparent. Right? We don't know that that's what it is. That's not usually what brings someone into the office. It's usually the branch, which is the more acute manifestation of the deeper cause. Like, a headache. Someone has a headache, but the root cause of that headache is, could be, like I said before, some kind of deficiency, or it could be a lifestyle factor. But we want to do both. We want to treat both, the root and the branch, because of course you want to feel better. So you want to have the branch taken care of, but the root is really where you're going to have the most impact over time. So we always are looking at both of those. And it's the physician's job is to look at what can be changed. Some things can't even be changed. I mean, personally, I think almost everything can be changed. So, but I think I'm also I tend to have more of an optimistic view, but I think that's a good thing. I do think, but it's not just being optimistic. I truly think everything really can be changed. But there is sort of the art of kind of figuring out what can be changed most quickly, what is going to take time, and that's where someone asks me, well, how long is this going to take? And it is kind of hard to gauge, although once I work with someone maybe 1 or 2 times, I can usually actually see by the methods of diagnosis that we use, like feeling the pulse and looking at the tongue and listening to them and just having a sense of their overall health and constitution and well-being, I can usually say generally how quickly something can take. So, and some things need to be, some things really do take a lot of time, but yeah, I think it's just like anything, with consistency and determination, you can do so much. So a few main things I wanted to say about East and West. So the Western view